Hello, and thank you for joining us tonight on another episode of our weekly news review. As always, we highlight to you the major activities that happened during the week. With me, Aisha Abdullahi Aminu, as the anchor of the reviews. On the week under review, we reported to you that Sokoto State Government has reaffirmed its commitment to improving the health sector by supporting UNICEF in implementation of the SOP emergency response, providing free healthcare services to vulnerable populations, and supplying gadgets to enhance data collection. The assurance was given by the State Deputy Governor Idris Mohammed Gobir during a visit by the new UNICEF country representative, Ms. Wafa Said, who came for a familiarization in Sokoto. The report. During his address, the Deputy Governor of Sokoto State, Alhaji Idris Mohammed Gobir, who represented Governor Ahmed Aliyu, expressed satisfaction with UNICEF's commitment to improving the health sector in the state. He noted that health is one of the key priorities in Governor Ahmed Aliyu's 9-point agenda, assuring that the state government will remain actively involved in implementing relevant activities.
Coming to Sokoto State, as you have just said, that you will make mention of Sokoto by the time you go to other states, so that from what we have saw, honestly speaking, our official, our people, our government, our leader, are all committed, 100% committed to improve the well-being of our people.
Alhaji Gobir further pledged that the government will continue to provide all necessary support to UNICEF for the smooth execution of its programs in Sokoto State. Earlier, the newly appointed UNICEF country representative, Mrs. Wafa Said, explained that the organization's interventions are aimed at promoting the well-being of people, particularly women and children across the globe.
Sokoto have committed 500 million naira for nutrition supplies. In UNICEF, we have mechanism called the Joint Nutrition Fund, that for every naira from the Sokoto state, UNICEF will put another naira to be doubled. So that is really excellent, and we're looking forward, as soon as these are released, UNICEF will also put equal amount to buying nutrition supplies. This really shows the commitment and the leadership of the state.
She also assured that more support will be provided by UNICEF to strengthen and enhance healthcare delivery in Sokoto State. The highlight of the meeting was the presentation of UNICEF's program to the state government.
Thank you, excellent. Thank you so much.
In attendance were the newly appointed Deputy Country Representative in charge of operations, Mr. Charles Opikoli Lolika, the Secretary to the State Government, Special Advisors, the Commissioners for Health and Budget and Economic Planning, the Executive Secretary of Primary Healthcare Development Agency, UNICEF State Representatives, among others. We also reported to you that the Sokoto State Government has launched a statewide ambulance emergency service aimed at improving healthcare delivery and responding promptly to emergency situations. Our correspondent, Rabi'u Abdullahi Wakili, reported that the program was commissioned by the Sokoto State Commissioner for Health, Dr. Faruk Umar Abubakar, at the ministry. His report.
Speaking during the commissioning of the program, the Sokoto State Commissioner for Health, Dr. Faruk Umar Abubakar, explained that the ambulances has been fully renovated and are capable of meeting emergency demands. The service is expected to cover road traffic accident, gunshot wounds, maternal emergencies, and other critical cases, with a central control room to be established at the Specialist Hospital in Sokoto. The Commissioner further noted that emergency response numbers has already been applied for through the National Communication Commission, but GSM lines will be used in the meantime. He added that staff have been deployed to work 24 hours daily to respond to calls from across the state, with ambulances stationed in Sabon Birni, Isa, Shagari, Bodinga, Yabo, Tambol, Benji, Silame, and Ilela local government areas.
Details will be released to the public later, but for now we are launching it so that the people know that we have launched our formal state ambulance services in order to provide and respond to emergencies across the state. And I already told you not all the cases that we're going to respond.
Additionally, Yusuf Haruna Argungu, the representative of the National Emergency Medical Services and the ambulance system, explained that the initiative is designed to be sustainable with funds already allocated at the national level. He revealed that commercial vehicle operators will be engaged to expand coverage provided they are verified and registered. Under the arrangement, tricycle operators will be paid 10,000 per response, while fully equipped ambulances will receive 50,000 naira and those without full kit 30,000 naira, with payment made directly after verification. He stated that the initiative is not only for the city resident, but is designed to reach rural communities, assuring timely medical response across the state. Reporting for Alu TV News, Ravi Abdullahi Wakili.
However, we reported to you that the Sokoto State House of Assembly Committee on Health, chaired by Honorable Kabiru Dauda of Gada East constituency, has conducted an oversight visit to the abandoned construction sites of the general hospitals in the Yeshuni and Wamako local government areas. Our legislative correspondent, Jamilu Musa Meshanu, reported that the visit followed constitutional provisions and House resolutions of September 3rd and 9th, 2025, which mandated the committee to investigate the reasons behind the stalled projects. Report.
At Dengeshuni General Hospital, the contractor Honorable Umar Mode Hilia received the lawmakers and conducted them around the site. The committee expressed concern over the total absence of already installed doors, windows, and other essential facilities at the hospital. At Wamoko General Hospital, representative of former client Ministry of Health, and the current client Ministry for Local Government, were present to brief the legislators. However, the contractor or his representative was absent, prompting the committee to summon him to appear before the House on Monday, 29 September 2025 at 10 a.m. for further clarification. Speaking after the inspection, Honorable Kabiru Dauda said the committee will study its findings and submit a comprehensive report and recommendation to the House. He reiterated the committee's resolve to ensure that the significant public resources invested in the projects are not wasted. Other members of the committee present on the visit were Honorable Mustafa Abdullah Hidar Sokoto South 1, Honorable Abubakar Shehu Yabo, Honorable Abdullahi Zakari Raba, Honorable Tukur Umar Binji, Honorable Sraju Muhammad Dengeshuni, Honorable Abdullahi Muhammad Randa Tureta, and Honorable Ismail Hamid Sukebi. The committee secretary, Bashar Ibrahim Gandhi, and other secretariat staff were also part of the entourage. Jamilu Musa Maishanu, reporting for Alu TV News.
Still on the week, we brought to you that the wife of Sokoto State, Hajia Fatima Ahmed Aliyu, has flagged off the distribution of cash and food assistance to 320 women entrepreneurs across the 23 local government areas of the state. The IFAD-assisted climate change and agri-support program aimed at empowering women to enhance productivity and self-sufficiency. A Government House correspondent, Nasir Abubakar Kiri, will tell us more.
The program targeted small-scale businesses, which include rice, soya beans, beans processing, the popular Hausa delicacies of tuwo, kwai da kwai, kosai, fura, among others. The First Lady said the move is part of an effort to provide job opportunities and business sustainability among women and other vulnerable groups. Hajia Fatima recalled that since the inception of the Ahmed Aliyu-led administration, thousands of women have been trained and provided with start-off grants to make their lives better and enhance societal development.
Equally, I have complimented the efforts of this administration by undertaking several programs aimed at alleviating the suffering of our women and children across the states.
She also reiterated the commitment of the present administration to assisting the vulnerable and needy through IFAD and other related programs, while calling on the beneficiaries to utilize the assistance. In her welcome address, the State Commissioner of Women and Children Affairs, Hajia Hadiza Balashakari, enumerated several initiatives that will soon be embarked upon by the state government to include the rehabilitation of women's centers across the 23 local government areas of the state and the distribution of free gas cylinders to women, among others.
Today's program speaks directly to the urgent needs of our time. We are all aware that climate change poses significant threat to food security.
Other speakers at the event were IFAD State Coordinator Muhammad Abdullahi Janzomo, State APC Woman Leader Rabi Abubakar Tudunwada, and State Commissioner of Agriculture Tukur Alkali, who applauded the state government for its various efforts to assist women and vulnerable groups in the state. Highlight of the event were the symbolic distribution of the assistance to the beneficiaries. Reporting from Government House Sokoto, I am Nasir Abubakar Kiri.
During the week under review, we also reported to you that the chairman of Kwari local government area of Sokoto State, Ibrahim Atahiru Gargiwa, has commended Helen Keller International, a non-governmental organization, for its kind support to the local government. He also pledged to play his part in providing what is needed to ensure the smooth implementation of the organization's program. The chairman made the remarks during the visit of the special advisor on NGOs and to the local government for an assessment exercise. Ibrahim Ahmad Aiken Allah reports.
While receiving the visitors at his office on behalf of the chairman of Yabo local government, the vice chairman Alhaji Usman Adlayabo stated that the area is fortunate to have the presence of the Helen Keller organization. He also conveyed the chairman's message calling on the organization to sustain the tempo and establish a proper channel for briefing him on statistics, especially in the aspect of Alu Tv support. Shortly after leaving the chairman's office, the special advisor and his entourage visited the WCWC in Yabo for an assessment. During her remarks, the in charge of the facility, Zainab Abubakar, explained that they have so far enrolled over 280 children for nutritional support. She added that they also provide MMS for pregnant women and have established a support group. The community officer, Minasar Bello, drew the attention of the local government to the need to complement the nutritional support by providing essential medications such as amoxicillin and deworming tablets. At the primary health center, Bakali, about 218 malnourished children were enrolled and are receiving nutritional support daily. Varieties of seedlings were also distributed for home gardens, which if properly utilized will provide more nutrients for mothers and children and serve as an additional source of income. At the facility in Bakali, the in-charge Abubakar Omar stated that with Helen Keller's intervention, the community now patronizes the facility more than before, and the antenatal care services have become more comprehensive. The Director General Shehu Muhammad Gorenyo, on his part, assists the management of the health center regarding the proper handling and safety of the products provided. During an interview after the exercise, the special advisor Honorable Abubakar Ahmed Sokoto described Helen Keller's activities as excellent.
We have seen yesterday and today about the activities of the Helen Keller. In fact, they have supported 100%. I can mark them 100% for what I have seen in Yawu and Kwari.
Officials of the organization also shed more light on the primary objectives and achievements of the organization so far.
When it comes to the nutrition intervention here in Sokoto State, like I told you, under the project we are working is Transforming Life Through Nutrition. This Transforming Life Through Nutrition, we are supporting almost 23 LGS here in Sokoto State with multiple micronutrient supplementation. Out of these 23 LGS, we have 244 health facilities where we distribute these MMS across these 244 facilities, and the MMS is free of charge.
Like we have all seen, what we have been telling the state government that we are supporting the state with in terms of different intervention have been seen basically through this assessment or joint supervision with the NGO and donor agency.
Ibrahim Ahmad Aikin Allah, Alu TV News.
On the week, we reported to you that the Sokoto State government has supported about 42,000 secondary school girls with financial support in continuation of its effort to promote girl-child education in the state through the Adolescent Girls Initiative for Learning and Empowerment Project Agile. The symbolic flag off of the conditional cash transfer, presided over by the First Lady Hajia Fatima Ahmed Aliyu, marked the beginning of the first cohort of the World Bank-funded initiative. Government House correspondent Nasser Abubakar Kiri has the details.
Launched in August last year, Agile is an intervention program geared towards encouraging school retention and completion among girl children by providing critical infrastructure and other activities to facilitate a conducive learning environment. Flagging up the first phase of the conditional cash transfer to adolescent girls in the state, the wife of the governor, Hajia Fatima Ahmad Aliyu, enjoined parents and caregivers to use the opportunity to enroll their wards to schools as a way of salvaging their families from abject poverty.
This program is a clear testimony of our government's commitment to investing in the future of our children, especially our girls, and to supporting families who strive every day to give their children the gift of education.
Hajia Fatima commended Governor Ahmad Aliyu for placing top priority on promoting girl child education and appreciated Agile and other development partners for the support extended to the program. She argued that when you educate girls, you educate the nation, adding that it is planting a seed of hope that will give birth to priority. In his keynote address, the State Agile Coordinator, Dr. Mansur Isa Buhari, said the program has achieved tremendous success since the inception of the Ahmad Aliyu-led administration.
Sokoto is one of the very few states in the country where the project is conducted without any political interference. And this is as a result of the commitment of the governor in ensuring that politics does not play a role in this project.
While calling on the beneficiaries to make use of the funds judiciously, he said the project targeted over 200,000 adolescent girls before the end of the initiative. In their separate remarks, the State Commissioner for Basic and Secondary Education, Professor Ahmad Ladan Allah, and representative of the Sultan of Sokoto, Aminu Daniyan Sokoto, and Agile National Coordinator Hajia Fatima, lauded the Sokoto State government for its continuous support to the project, which surpassed the 18 states captured in the World Bank-supported initiative. Highlight of the event were the performance and presentation by some benefiting students. Each of the beneficiaries received 40,000 naira, which will continue every term for as long as the project exists. Some of the beneficiaries could not hide their joy and appreciation while assuring to make the best use of the facility. Reporting from Government House Sokoto, I am Nasser Abubakar Kili.
During the week, we also brought to you that it has been asserted that curtailing the menace of out-of-school children and Almajiri in Sokoto State requires a collective approach as the number continues to increase. The statement was made during a high-level dialogue on reducing the alarming number of out-of-school children and Almajiri in Sokoto State. Abdurrashid Wadata Buhari reported that the meeting was held at the auditorium of Sultan Muhammad Machidu Institute for Quran and General Studies, Sokoto. This report.
The dialogue provided a unique platform for policymakers, traditional and religious leaders, local government chairmen, development partners, civil society groups, and community representatives to deliberate on practical solutions and commit to measurable actions.
We know that education is the bedrock of development, and we cannot afford to be behind. And we know that Sokoto will always want to be at the top of things. And so we will count on you as we set up for this journey. We will be working with you at different levels with the hope of addressing the issues at hand.
Addressing the delegates, the State Commissioner for Basic and Secondary Education, Professor Ladan Ahmad Allah, challenged education stakeholders to ensure effective monitoring and inspection of schools to mitigate the menace. The Commissioner stated that to strengthen the educational system in the state, political sentiments must be avoided in appointing school managers and posting teachers to schools.
We need to have all the stakeholders all the time in the schools so that let the teachers know that they are being monitored, they are being watched. And it is only through effective supervision that you will know who is going to school, who is not going to school.
Chairman of the State Technical Committee on Out-of-School Children, Professor Mustafa Namakatukur, said the committee has mapped out key strategies aimed at addressing the issue.
And this committee is working assiduously to see that we avert such anomalies, and at the same time we do everything possible to practically bring back children to schools, inshallah.
Also speaking, the chairman of the State Universal Basic Education Board, Umar Nagwari Tambuwal, said the government is doing its best to promote education by ensuring the payment of over 25,000 teachers' salaries and providing education needs in schools. Speaking on behalf of the local government chairman of the state, Barrister Maidao Kajiji, the chairman of Shagari local government area, described the initiative as timely and assured their support to achieve the desired goal. The meeting highlighted the need for collective action to strengthen the education system and ensure that all children have access to quality education. Abdurrashid Wadata Buhari, Alu TV News.
Also on the week, we brought to you that the Federal Ministry of Health has officially flagged off the Maternal and Neonatal Mortality Reduction Innovation Initiative, MAMI, commencing in the Yishuni, Gorenyo, Sabon Birni and Isa local government area of Sokoto State. A 5-year project that is worth about 2 trillion naira, designed to provide healthcare services to women and children, particularly those in hard-to-reach communities in every state across the Federation. The report. The national representative of the Federal Ministry of Health, Dr. Adamu Ahmed, said the initiative is a collaborative effort between the federal and state government to ensure the smooth and effective implementation of the program. Dr. Ahmed highlighted that the initiative focuses on improving primary healthcare facilities in all states, including infrastructure and provision of ambulance services to support pregnant women, children, and other vulnerable groups.
Total funding for 5-year project is over 2 trillion naira. So it is in US dollars, and this money is being pushed to the states as grants. So the state do not have to pay back the federal government under that year. So there are, but it is performance based. Every state that performs wonderfully will be reimbursed this funding. So it's not sit and get your check. It is stand and work and deserve your pay.
In Sokoto, a 5-day stakeholders workshop on the implementation plan was organized, after which the program was officially unveiled in Shuni local government area. The Commissioner for Health, Dr. Faruk Umar Abubakar, stated that all health agencies in the state will work collaboratively to ensure the successful implementation of the initiative and to eradicate maternal and child mortality. He added that research has shown a steady rise in maternal mortality rates, stressing that traditional and community leaders have a crucial role to play in ensuring the success of the program.
Sokoto is so much committed to ensure the full implementation. The roadmap that was developed, initiated, and the developer have already launched and inaugurated the task force committee
under my able leadership, with all the relevant agencies under the Ministry of Health will serve as the members. And that within a couple of days we are going to sweep into action to ensure that the roadmap set aside will fully implemented.
Dr. Farouk further noted that the Sokoto State government, through the Ministry of Health, has provided full support for the initiative, including the establishment of a Mami Task Force Committee to oversee its implementation. In his remarks, Shuni Muhammadu Jabi Harinde II expressed his deep appreciation to both the federal and state governments for prioritizing the health and well-being of the people.
An fara mami a jihar Sokoto, wannan shine shaidan. To bismillahirrahmanirrahim.
The flag-off ceremony was attended by representatives of the Federal Ministry of Health, Special Advisor, Primary Healthcare Development Agency, Dr. Muhammad Bello Marnona, representative of the Sultanate Council, the Vice Chairman of Shuni Local Government, Development Partners, the Executive Secretary of the Malaria Elimination Agency, the Executive Director of Medical Services, as well as directors from the State Ministry of Health. Well, with that, we've come to the end of this week's weekly news review. On behalf of the producer and production team, I am Aisha Abdullahi Aminu saying stay tuned for the Hausa version coming up shortly. Thank you for watching. Bye-bye.